Welcome to the Health AI Brief, breaking down the AI shaping our world one concept at a time. We have AI systems that can analyse an ECG in seconds, and others that can listen to a consultation and draft a clinic note. They're powerful, specialised tools, but in the wider world we hear very different conversation about AI, discussions about machines becoming conscious, or a future superintelligence that could change humanity forever. It can be difficult to reconcile these two realities, the pragmatic tools we're beginning to use in our hospitals and the science fiction scenarios that dominate the headlines. How do we make sense of this? The key is to understand the fundamental difference between the AI we have today and the AI that may exist tomorrow. It's the difference between narrow and general intelligence. The AI we use today, without exception, is in a category known as narrow AI. You can think of this as kind of a world-class super specialist. It might be the best in the world at spotting diabetic retinopathy, say, but it knows absolutely nothing else. It can't read a chest x-ray, it can't order a blood test, and it can't tell if the patient's symptoms started yesterday or 2 years ago. It has a deep expertise in one single narrow domain without capability outside of it. AI development's always looking to expand the scope of what these narrow AIs can do, but they've still not reached the next hypothetical step, which is often termed artificial general intelligence, or AGI. This is the goal that many frontier AI companies and researchers are working towards currently. AGI would have human-level cognitive abilities across a wide range of tasks. It could, say, learn to reason, problem-solve in a flexible way, much like we do. An AGI could, in theory, read a patient's notes, look at their scans, synthesize a differential diagnosis, and then switch tasks to analyze the stock market or compose music. There's significant debate in the field about exactly when and how we might get there. Beyond artificial general intelligence lies a further, even more speculative stage known as artificial superintelligence, or ASI. This is an intellect that would vastly exceed the brightest human minds in practically every field, from scientific creativity to social wisdom. This is the AI of most science fiction, an intelligence that could solve problems and develop new technologies at a speed that we can't even comprehend. And this, of course, remains firmly within the realm of theory. So why does this spectrum from narrow AI of today to the theoretical superintelligence of tomorrow matter to us as clinicians? I think first it allows us to ground our expectations. So when a company presents a new AI tool for your hospital or healthcare service, you know that you're dealing with narrow AI. The job is to rigorously assess its performance within this one specific task, its so-called intended purpose. You need to think carefully about what specific purpose was it designed for, what specific types of data. You need to ask what's its precise function, what are the specific areas it can safely operate in, what are its failure modes, and what happens when it encounters something just outside of its narrow training. Second, this framework helps us separate the hype from reality. The long-term ethical debates about AGI and ASI are incredibly important for society, but they're not directly relevant to the clinical validation of a new ECG algorithm you might use tomorrow, which is much more of a narrow AI. And we mustn't let the speculative long-term conversations distract from the immediate practical task of appraising the narrow tools in front of us with clinical rigour. And finally, it gives us a lens through which to view the future. While true ASI isn't on the immediate horizon, the push towards it is making narrow AI more capable and flexible, as we see this with kind of the growing range of things that large language models can do. We're starting to see these so-called foundation models that can be fine-tuned to several different related medical tasks. It's a trend to watch, but it's still a world away from the adaptable general intelligence of a human clinician. So that's the spectrum of AI in a nutshell. We live and work entirely in the world of narrow AI currently, and knowing its limits is the key to being able to use it safely and effectively. If you found this useful, please hit subscribe or follow in your podcast app so you don't miss future episodes.